So a mastopexy is a breast lift procedure. It's designed to reposition a breast that may have descended lower on the chest wall or onto the upper abdomen back into its normal position. It's not designed to increase the volume of the breast or decrease the volume of the breast, but really just to reposition the existing breast back in the correct place. Patients that present for consideration of a breast lift are often women that have gained weight and then lost a lot of weight, or women who have breastfed and then noticed deflation of the breast afterwards. You know, they kind of feel like they have to hold their whole breast in their bra, that it's not just holding it up in the correct position for them. It's a day procedure. What's involved is marking on the chest the new position of the nipple, measuring the amount of excess skin, because that's the underlying problem with a ptotic breast, is that there's too much skin for the amount of breast tissue there is. Repositioning the breast tissue back into the correct place on the chest wall, and then removing the excess skin and tightly closing the remaining skin to kind of hold the breast back up in that position. Patients would go home typically the same day in a post-operative garment for which they're measured and is provided for them from the clinic. We would follow up with that patient typically after a few days back in the rooms. Those patients would be back to their normal activities of daily living within about a week or two. It's not typically a very painful procedure post-operatively. Most people are surprised at how well they're able to control any pain with their routine post-operative medications. Those wounds are taped for a period of 6 weeks afterwards, and then I'd see them again and speak to them about silicone or vitamin E and massage and those sort of techniques to optimise their scarring outcomes. Most women are able to go back to normal exercise and have essentially no physical limitations at about that 6 week mark post-operatively.